Assalamu alaikum. Bismillahir Rahmanir Rahim. Quote of the day. The two most important days in your life are the day you are born and the day you find out why. I'm Dr. Nabeela Umar, and today I'm going to present the topic of arthritis under the kind supervision of Professor Dr. Saira Afzal. Learning outline. What is arthritis? What are the different types of arthritis? Differences between rheumatoid and osteoarthritis, the general causes of arthritis, its risk factors, diagnosis, treatment, recent updates, and at the end, multiple choice questions. Learning outcome. At the end of the presentation, participants will have a broad overview of arthritis, its definition, types and their subsequent causes, differences, risk factors, as well as how to diagnose and treat each type. Introduction. Arthritis refers to more than 100 rheumatic diseases and conditions that affect joints. These conditions tend to involve pain, aching, stiffness, and swelling in and around one or more joints. The word arthritis means joint inflammation. However, inflammation may also affect the tendons and ligaments surrounding the joint. The symptoms can develop gradually or suddenly and may impair a person's ability to perform everyday tasks. Different types of arthritis. Mainly, arthritis is divided into groups which are described below. Connective tissue disease. Connective tissue is a tissue that holds together or divides other body tissues and organs. Pain in the joints is the common symptoms of connective tissue disease. Scleroderma and dermatomyositis are popular examples. Rheumatoid arthritis. It is a chronic autoimmune disease that affects both joints of the knees, wrist, or hands. Metabolic arthritis. Uric acid is a chemical developed as the body classifies a substance called purine found in human cells and food. This arthritis creates spikes of joint pain and even gout attack. Infectious arthritis. This is the result of the virus or fungus that enters the joint and stimulates inflammation. These are the various types of arthritis: rheumatoid arthritis, ankylosing spondylitis, osteoarthritis, juvenile idiopathic arthritis, psoriatic arthritis, gout, and septic arthritis. Now we'll see one by one different types of arthritis. Osteoarthritis. It is also known as degenerative joint disease and is the most common type of arthritis. It is likely to develop as people age. The changes in osteoarthritis usually occur slowly over many years, though there are occasional exceptions. Inflammation and injury to the joint cause bony changes, deterioration of tendons and ligaments, and a breakdown of cartilage, resulting in pain, swelling, and deformity of the joint. This is a normal joint, and these are the changes that occur in osteoarthritis. Types of osteoarthritis: primary or idiopathic. It is the most common type, and it affects the fingers, thumbs, spine, hips, knees, and the great big toes. Secondary. Occurs with the pre-existing joint abnormality, including injury or trauma, such as repetitive or sports-related inflammatory arthritis, such as rheumatoid, psoriatic, or gout. Infectious arthritis, genetic joint disorders, such as Ehlers-Danlos syndrome. Etiology. Osteoarthritis can be due to a genetic cause, metabolic cause, hormonal, mechanical, or it can be due to an aging process. Symptoms. Pain, stiffness. Joint stiffness might be the most noticeable upon awakening or after being inactive. Tenderness, loss of flexibility, grating sensation, bone spurs, and swelling. Treatment of osteoarthritis. Analgesia, oral visco supplements, intra-articular steroids, intra-articular visco supplements, altered activity, walking aids, and physiotherapy. The second type of arthritis is ankylosing spondylitis. It is a form of arthritis that causes chronic spine inflammation. It inflames the sacroiliac joints. This inflammation, called sacroiliitis, is one of the first signs of ankylosing spondylitis. Inflammation often spreads to these joints between the vertebrae. This condition is known as spondylitis. Some people with ankylosing spondylitis experience severe, persistent back and hip pain and stiffness. Over time, new bone formation may fuse vertebra section together, making the spine rigid. This condition is called ankylosis. Symptoms include stiffness, which is the first thing in the morning, lower back pain, sciatica, which is a pain along the sciatic nerve running from the lower back into the legs, and neck pain. What causes ankylosing spondylitis? 95% of the people who have ankylosing spondylitis have a variation of a human leukocyte antigen B gene. This changed or mutated gene produces a protein called HLA-B27 that increases disease risk. Having one of these conditions may also increase your risk: Crohn's disease, ulcerative colitis, and psoriasis. The third type is the juvenile idiopathic arthritis. It is the most common type of arthritis that affects children, a chronic disease that can affect joints in any part of the body. An autoimmune disease in which the body's immune system mistakenly targets the synovium, which is a tissue that lines the inside of the joint, and the synovial fluid in the joint. This causes the synovium to make extrasynovial fluid, which leads to swelling, pain, and stiffness in the joint. The etiology is unknown. The peak age of idiopathic juvenile arthritis is 2 to 4 years. It is typically negative for autoantibodies. It includes anemia, leukocytosis, thrombocytosis, and complications of juvenile arthritis include macrophage activation syndrome. The child has intermittent fever, generalized lymphadenopathy, hepatomegaly or splenomegaly, serositis, arthritis, synovitis, and transient salmon pink rash. Laboratory tests include anti-nuclear antibody, rheumatoid factor, C-reactive protein, erythrocyte sedimentation rate, and cyclocitrullinated peptide antibody test. The treatment include eliminate the active disease, normalize joint function, preserve normal growth, prevent long-term joint damage, and prevent patient disability. The American College of Rheumatology Pediatric 30 criteria defines improvement as involving at least 3 to 6 core set variables with no more than one of the remaining variables worsening by more than 30%. The next type of arthritis is gout. When the body has extra uric acid, sharp crystals may form in the big toe or other joints, causing episodes of swelling and pain called gout attacks. It typically affects the big toe, but it's also found in other joints, including the knee, ankle, foot, hand, wrist, and elbow. Who is affected by gout? People are more likely to get gout if they have obesity, congestive heart failure, diabetes, family history of gout, hypertension, kidney disease. You are also more likely to develop gout if you consume a diet high in animal proteins and if you consume a significant amount of alcohol and if you are on diuretics. Acute gouty flares. It includes the abrupt onset of severe joint inflammation, often nocturnal, warmth, swelling, erythema, and pain, possibly fever. If it remains untreated, it can resolve in 3 to 10 days. In 90% cases, first attacks are monoarticular, and in 50% cases are podagra. Gout risk factors: male, postmenopausal female, older, hypertension, pharmaceuticals including diuretic, ASA, and cyclosporine. The treatment of gout includes some drugs which can help control symptoms, non-steroidal anti-inflammatory drugs, colchicine, which can reduce inflammation and pain if you take it within 24 hours of a gout attack, corticosteroids. Drugs that have lower levels of uric acid in your body to prevent or reduce future episodes of gout attacks include allopurinol, fubozostat, pegloticase, probenecid. The next type is psoriatic arthritis. It is a kind of autoimmune inflammatory arthritis which develops in 30% of people with the skin condition of psoriasis. What is psoriatic arthritis? It is characterized by joint pain, swelling, and morning stiffness. Psoriatic arthritis can vary from mild to severe. It can present in the following ways. Oligoarticular, affect 4 or fewer joints in the body. Polyarticular, affecting 4 or more joints. Spondylitis, which is less common and affecting the spine, hip, and shoulders. The cause of psoriatic arthritis is unknown. Researchers suspect that it develops from combination of genetic and environmental factors. Recent research has shown that people with psoriatic arthritis have an increased level of tumor necrosis factor in their joints and affected skin areas. Treatment includes NSAIDs, DMARDs, which include methotrexate, leflunomide, sulfasalazine, cyclosporine, tumor necrosis factor alpha inhibitor. The treatment should include a coordination between rheumatology and dermatology department. The next type is rheumatoid arthritis. Rheumatoid arthritis is a type of arthritis where your immune system attacks the tissue lining the joints on both sides of your body. It may affect other parts of your body too. The exact cause is unknown. Treatment options include lifestyle changes, physical therapy, occupational therapy, nutritional therapy, medication, and surgery. What is rheumatoid arthritis? It is an autoimmune disease that is chronic. It occurs in the joints on both sides of your body, which makes it difficult from other types of arthritis. You may have symptoms of pain and inflammation in your fingers, hands, wrists, knees, ankles, feet, and toes. Rheumatoid arthritis include symptoms like fatigue, eye conditions, dry mouth, lung scarring or nodules, heart disease, digestive problems, skin conditions, cartilage damage, and inflammation. Uncontrolled inflammation damages cartilage, which normally act as shock absorber in your joints. In time, this can deform your joints. Eventually, your bone itself erodes. This can lead to the fusion of your joints, an effort of your body to protect itself from constant irritation. Specific cells in your immune system, your body's infection fighting system, aid this process. These substances are produced in your joints, but also circulate and cause symptoms throughout your body. In addition to affecting your joints, rheumatoid arthritis sometimes affect other parts of your body, including your skin, eyes, mouth, lung, and hearts. There are certain types of laboratory tests which can help in the diagnosis of rheumatoid arthritis. First is the physical examination, then is the family medical history, rheumatoid factor, and anti-citrullinated peptide blood test, ESR test, and X-rays. The treatment of rheumatoid arthritis include NSAIDs, which are the non-steroidal anti-inflammatory drug. It often needs high doses. DMARDs, which are disease-modifying anti-rheumatic drugs, usually your first line of treatment, for example, methotrexate. Biologics, newest kits on the treatment block, offer powerful and highly targeted treatment to slow rheumatoid arthritis progression. And steroids, which are helpful for calming flares, can be injected into joints for quick relief, best for short-term use only. Now, how we can differentiate between osteoarthritis and rheumatoid arthritis? Osteoarthritis is a degenerative joint disease, whereas rheumatoid is an autoimmune disease. Osteoarthritis develops gradually over years as the joint cartilage wears away, while rheumatoid develops and worsens over several weeks or months. Osteoarthritis is the most prevalent form of arthritis, affecting more than 30 million adults in the United States, whereas rheumatoid arthritis affects 1.3 million Americans, of which 75% are women. Osteoarthritis is most commonly affect the hip, knee, lower back, neck, feet, and finger joints, whereas rheumatoid affect any joint. It is common in hands, wrist, and feet. In osteoarthritis, the joint stiffness is mild in the morning and occurs after a few hours of inactivity during the day, whereas rheumatoid, it is prolonged hours of stiffness and takes longer hours to subside. The symptoms of osteoarthritis include joint pain, stiffness, muscle weakness, reduced motion, and creaking, whereas rheumatoid include pain, stiffness, inflammation, bumps or nodules, fatigue, fever, loss of appetite. The treatment of osteoarthritis include pain medicine, heat or ice, weight loss, exercise, surgery, whereas rheumatoid arthritis treatment includes rest, splints, balanced diet, exercise, and healthy weight. Now, on a general view, what causes arthritis? Arthritis may be caused by wear and tear of a joint from overuse, age, in which osteoarthritis is the most common in adults over age 50, injuries, obesity, autoimmune disorders, genes or family history, and muscle weakness. How is arthritis diagnosed? First, seeing your primary care physician is a good first step. They will perform a physical examination to check for fluid around the joints, a warm or red joints, and document the range of motion in the joints. Blood tests, they check for specific type of antibodies like anticyclic citrullinated peptide, rheumatoid factor, and antinuclear antibody are also common diagnostic tests. Doctors commonly use imaging scans such as X-rays, MRI, and CT scans to produce an image of your bones and cartilage. How is arthritis treated? The main goal of treatment is to reduce the amount of pain you are experiencing and prevent additional damage to the joints. You will learn what works best for you in terms of managing pain. In general, treatment of arthritis includes a combination of medicines and supplements, physical therapy, occupational therapy, nutrient-rich diet, regular exercise, weight loss if needed, heat and cold compresses, mobility assistant devices such as canes or walkers. Improving your joint function is also important. Your doctor may prescribe a combination of treatment methods to achieve the best results. Medications. A number of different types of medication treat arthritis. For example, analgesic are effective for pain management, but they do not help decrease inflammation. For example, acetaminophen or hydrocodone. Non-steroidal anti-inflammatory drugs such as ibuprofen and salicylates, which help manage pain and inflammation. Menthol or gaspacin creams, these creams block the transmission of pain signals from your joints. Steroids like prednisone. Immunosuppressants and biologics are prescribed for moderate to severe inflammatory arthritis like rheumatoid arthritis. If you have rheumatoid arthritis, your doctor may recommend corticosteroids or disease-modifying anti-rheumatic drugs which suppress your immune system. DMARDs and biologics are being prescribed early in the course of rheumatoid arthritis, Methotrexate is now a first-line drug of treatment. There are also many medications to treat osteoarthritis available over the counter or by prescription. Supplements. While clinical evidence and safety are lacking for many herbs and supplements marketed for arthritis, there are few supplements that may be beneficial. For example, avocado and soya bean may help osteoarthritis symptoms. Fish oil and turmeric supplements may help reduce inflammation in rheumatoid arthritis. Surgery. Surgery to replace your joint with an artificial bone may be an option. This form of surgery is most commonly performed to replace hips and knees. If your arthritis is more severe in fingers or wrist, your doctor may perform joint fusion. In this procedure, the ends of your bones are fused, eliminating the joint and therefore eliminating the site of inflammation. Physical therapy. Physical therapy involving exercises that help strengthen the muscles around the affected joints is a core component of arthritis treatment. Prevention from arthritis. Following methods are used in order to prevent arthritis. Stay active, diet rich in calcium, rest, control weight gain, plenty of water intake, yoga, and other light exercises. Recent updates. The efficacy of intra-articular platelet-rich plasma injection versus corticosteroid injection in the treatment of knee osteoarthritis. Knee osteoarthritis is the most typical cause of knee pain and impairment worldwide. The comparison of effectiveness of indifferent intra-articular injections in knee osteoarthritis treatment in Pakistan is still not thoroughly investigated. Therefore, the purpose of this study is to compare the efficacy of intra-articular administration of platelet-rich plasma and corticosteroids in the treatment of knee osteoarthritis. In the study, patients were divided into two equal groups through simple random sampling. Group A patients receive an intra-articular injection of PRP solution, and Group B patients receive an intra-articular injection of corticosteroid. According to the results, women had a higher prevalence of knee osteoarthritis than men. In the study, it was shown intra-articular infiltration of both PRP and corticosteroids were efficacious in the treatment of knee osteoarthritis-related pain and functional limitations. However, overall improvement in the PRP group was higher than corticosteroid group. Corticosteroid reduces both pain and functional limitations swiftly, but for a lesser time period in contrast to PRP. However, PRP provided betterment in pain and functional restriction slowly, but for a larger duration in comparison to corticosteroid. So as a result, the study suggests that PRP therapy plays a relatively better role in knee osteoarthritis management than corticosteroids. Prevalence of hearing impairment among gout patients. A limited amount of research suggests that systemic inflammation and some gout treatment may cause hearing impairment indirectly as a result of gout. A cross-sectional study was conducted in which it was seen for hearing evaluation, pure tone audiometry and record-keeping performer was used. According to the study demonstrates a significant prevalence of hearing impairment in gout. The most frequent hearing impairment was sensorineural and most experienced hearing impairment of a mild to moderate degree. Cochlear-related autoimmune hearing impairment, autoantibodies, the development of granuloma and vasculitis all have been linked to a similar inflammatory response that destroys tissue. Gout-related persistent inflammation and oxidative damages may also contribute. An overabundance of free radicals in the spiral ganglion neurons, cochlear sensory epithelium, and stria vascularis cells is well recognized as a major element in the cause of cell destruction in the inner ear. Corticosteroids and NSAIDs are two examples of gout medication that may have adverse effects that might impact hearing. For instance, excessive doses of non-steroidal inflammatory drugs have occasionally been linked to tinnitus or temporary hearing impairment. The study demonstrated a significant prevalence of hearing impairment in gout. The most frequent hearing impairment was sensorineural and mostly experienced hearing impairment of mild to moderate degree. Multiple choice questions. Number 1. A man 65 years of age developed pain and stiffness in his knees, which progressively got worse over a span of 7 years following an injury. He has lost some flexibility of his knee joint and experiencing a grating sensation upon movement. What condition is he suffering from? The answer is A, osteoarthritis. Number 2. A 40 years old obese man with poor drinking habits developed pain and swelling in the big toe. Upon visiting the doctor, he was diagnosed with gout. What is recommended as the first-line therapy for gout? The answer is B, allopurinol. MCQ number 3. A 9-year-old girl presents with persistent joint swelling, stiffness, and pain in multiple joints for the last 6 months. There is no history of trauma. Blood tests show elevated inflammatory markers, and she is diagnosed with an autoimmune condition affecting children. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Juvenile idiopathic arthritis. C. Psoriatic arthritis. D. Reactive arthritis. Or E. Ankylosing spondylitis.
B.
Yes, the answer is B. Juvenile idiopathic arthritis. MCQ 4. A 28-year-old man complains of persistent lower back pain and stiffness for the past 2 years, which worsens in the morning and improves with activity. His X-ray shows sacroiliitis. He also has a positive HLA-B27 genetic test. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Ankylosing spondylitis. D. Psoriatic arthritis. Or E. Gout.
C.
Yes, the answer is C. Ankylosing spondylitis. MCQ number 5. Which of the following statement is true regarding the difference between rheumatoid and osteoarthritis? A. Rheumatoid primarily affect weight-bearing joints while osteoarthritis affects small joints of the hands. B. Rheumatoid symptoms worsen with activity while osteoarthritis improves with movement. C. Rheumatoid is an autoimmune disease while osteoarthritis is due to wear and tear. D. Rheumatoid is characterized by morning stiffness lasting than 30 minutes while osteoarthritis stiffness lasts longer. Or E. Rheumatoid is a non-inflammatory disease whereas osteoarthritis is an inflammatory arthritis.
D.
The answer is C. Rheumatoid is an autoimmune disease while osteoarthritis is due to wear and tear. MCQ number 6. A 55-year-old man with chronic knee pain undergoes imaging to confirm his arthritis type. Which imaging modality is must use for detecting early cartilage damage in osteoarthritis? A. X-ray. B. CT scan. C. MRI. D. Ultrasound. Or E. Bone scan.
Alpha.
The answer is C. MRI. MCQ number 7. A 50-year-old woman presents with joint pain, swelling, and stiffness in both hands for 6 months. Her doctor orders blood test and imaging. Which of the following laboratory findings is most specific for diagnosis rheumatic arthritis? A. Anticyclic citronellite peptide antibody. B. Elevated ESR and CRP. C. Uric acid level. D. HLA-B27 or E. Positive blood cultures.
D.
B.
The answer is A. Anticyclic citronellite peptide antibodies. MCQ number 8. A 42-year-old man with a 10-year history of psoriasis develops joint pain, morning stiffness, and swelling in both small and large joints. He also reports lower back pain. Examination showed dactylitis and nail pitting. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Ankylosing spondylitis. D. Psoriatic arthritis. And E. Infectious arthritis.
D.
Yes, the answer is D. Psoriatic arthritis. MCQ number 9. Ankylosing spondylitis is a form of arthritis that causes chronic spine inflammation. Ankylosing spondylitis inflames the sacroiliac joints located between the base of spine and pelvis. What does ankylosing spondylitis have in common with psoriasis and Crohn's disease? A. They all are contagious. They all are autoimmune disease. C. They are most common in South America. B. They have prominent skin symptoms. Or E. Typically found in children.
B.
Yes, the answer is B. They all are autoimmune disorders. MCQ number 10. Rheumatoid arthritis is a relatively common autoimmune disease with multiple treatment options. Which of the following is an example of a drug class that has been shown to halve or reverse the progression of this disease in most patients? A. Aspirin. B. Azathioprine. C. Everolimus. D. Methotrexate. Or E. Prednisone.
It's methotrexate.
Yes, the answer is D. Methotrexate. This is the key to the MCQs. This is the YouTube channel where the presentation will be uploaded. Thank you for your attention.